Do we need to deliver this locally to the lumen of the GI tract by enema or by oral route, or are we better off by a systemic delivery?
I think that's gonna be specific to specific conditions. Based on experimental evidence, these mediators, as far as we can tell, are active topically, they're active orally, they're active systemically. When we give them via IP, they're active. So we've done actually inhaled in models of COPD, animals of COPD, given these as a puff, and there was biological activity. So I think you want to try and get these mediators to where you want them to be, so to have the strongest effect with the lowest dose. But that doesn't mean that you can't try other routes of administration if that's more difficult or less probable.
I remember watching the presentation by Dr. Conti, I believe, and he talked about doing strictureplasty.
Right.
And after strictureplasty, I think I forget exactly the numbers, 29% or 30% restricture down.
Right.
Virtually by injecting these, he eliminates the restricture because he takes off that chronic condition where the thing strictures back down. So I just, like Steve, I'm sitting here thinking of all these potentials, things we got to study so we can start, you know.
I'm still injecting steroid into esophageal strictures and duodenal strictures from ulcer disease, and it's not that effective.
No. And there's also a lot of patients that are sensitive to steroids and also that create other side effects, especially upon chronic use.
I mean, like esophageal, like
EOE,
yeah.
So eosinophilic esophagitis, yeah, chronic inflammation.
Right. Where a lot of that is actually cysteine-leukotriene and thromboxane A2 mediated, especially from the eosinophils, which are big producers of cysteine-leukotrienes. These mediators have direct actions on that pathway, and they regulate. It's actually a very interesting paper that was published recently in PNAS, where they regulate the subcellular localization of the enzyme that's involved both in the biosynthesis of the resolvins and the cysteine-leukotrienes, and depending on where it is in the cell, it either produces leukotrienes or resolvins, and these mediators regulate that to change this biosynthetic pathway.